Yes, I'm ready.
All right. Good afternoon, everyone. I'd like to call to order the Health and Human Services and Aging Committee. Due to technical difficulties, we're not starting on time. Today is Wednesday, May 5th. And can we have a roll call, please, Madam Clerk?
Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Brown. Here. Mr. Miller,
Here.
Ms. Stevens.
Present.
We have a quorum.
All right. Madam Clerk, has anyone signed in for public comment today?
No, Madam Chair, no one submitted any public comment.
All right. Before we go to the approval of the minutes, I'd just like to just congratulate, pat on all of our backs that we opened up the diversion center yesterday. And so that was a big thing in this county. And so I just wanted to draw everybody's attention to it. And it was a ribbon cutting, but it actually, the grand opening, we had some guests in there already. So it's already
Congratulations.
fully functioning, and it's a good thing for the whole community, all of us to definitely benefit from it, as well as the residents that live in Cuyahoga County. So I would like to call for a motion for the approval of the minutes from the March 31st, 2021.
So moved.
Second.
Moved and seconded, moved by Sweeney, seconded by Brown. We have a couple of items before us today.
We need
And
a vote.
Can we all say aye for the meeting, the approval of the minutes for March 31st? Everyone say aye.
Aye.
Thank you. Thank you, Dale. Matters referred to the committee today. We have 2 items in front of us. So Madam Clerk, if you could read the first item into the record, please.
Resolution number 2021-0121, making awards on requisition number 4542 to various providers for various programs and services in the total amount not to exceed $1,651,000 for the Cuyahoga County Fatherhood Initiative for the period April 1st, 2021 to March 31st, 2023.
Thank you. And who is here to speak to this matter today? Or present?
Paul Porter from the Cuyahoga County Health and Human Services Division of Contract Administration and Performance. I'll be presenting both of the items that are on the agenda today, and I'll introduce the individuals that represent the departments that are on these items, and I'll let them introduce the providers that are here to speak on them as well. So I'll go ahead, if that's okay with you, and speak on the fatherhood item first.
Yes, please continue.
Perfect, thank you. So this is an award recommendation for contracts with multiple vendors covering a variety of services related to the mission of the Fatherhood Initiative. These different services include career services for fathers, boot camp for new dads, preventing premature fatherhood, healthy relationship building, public awareness for programs operated by the Fatherhood Initiative, school-based programming, and supervised visitation for fathers. There was an RFP completed in January, and contracts were developed with these vendors during February and March. We worked to get these contracts before council as soon as possible. There were some delays, particularly seeking compliant insurance certificates that met the requirements that were in the contract. So that's why we're coming before you a little bit after the start date of this contract. These contracts are funded 100% by the Health and Human Services Levy. And I'll turn it over to Al Grimes from the Fatherhood Initiative. Al, I don't know if you want to say a little bit more about the programs, as well as introduce the provider representatives that are here as well.
Thank you, thank you. And to Chairman Conwell and the rest of the county council members, good afternoon. As Paul said, I'm Al Grimes with the Fatherhood Initiative. I have with me today Mr. Maurice Stevens from Career Development and Placement Strategies Rising Above Program, Ms. Sandy Hope from Metro Health Boot Camp for New Dads Program, and Mr. Frederick Knuckles from University Settlements Healthy Fatherhood Program. And they're available to answer questions along with me. You know, as Paul indicated, these contracts represent 11 programs to be funded by the Cuyahoga County Fatherhood Initiative from April 1st of this year through March 31st of 2023. And as he indicated, there's a variety of programs aimed to assist fathers in helping both the financial and the emotional needs of their children. And that's why we have a range of programs, from job training and placement programs to the boot camp for new dads at 9 hospitals, to our programs in K-8 schools that Mr. Knuckles represents, to our prevention of premature fatherhood program, where we're talking to teens about not becoming a dad until you are financially and emotionally ready. And so that's why you see a variety of the programs, because we know dads not only need to be there financially, but they need to be there emotionally. And so that's how we think that fathers can be most assistant to the children's needs. These contracts will allow us to continue to serve fathers and families in Cuyahoga County in a much needed and critical capacity. Our mission is to significantly increase the number of fathers who are involved in nurturing and raising their children. You know, research has told us that when fathers are involved, children are less likely to drop out of school, less likely to become incarcerated, less likely to do drugs, less likely to commit crimes, and less likely to become teen parents. So we know that when both parents are involved in their children's lives, they live a more productive and healthy lifestyle. You know, our 4 goals of the Fatherhood Initiative are to make sure we continue to get the word out to fathers. If you are involved, stay involved. If you're not involved, get involved. The second thing that we try to do is we try to make sure that when fathers come to the county, they're treated as an equal parent, that it's a father-friendly environment when fathers come to the county for assistance. The third thing we do, as I stated, we fund programs to help fathers meet both the financial and the emotional needs. And the fourth thing, we have an annual conference, and we also have a Fathers Walk to School program where we celebrate healthy father-child relationships, because we know that there are a lot of dads out there doing everything that they need to be doing, but sometimes, you know, the emphasis on the fathers who are not doing the things that they need to be doing, which we know we need to help out with. But we want to celebrate healthy father-child relationships. We serve about 6,000 dads a year through our direct programs. We have our Fatherhood Conference, which serves another 600. We have our Fathers Walk to School program, where not last year because of COVID, but before that, we had 20,000 dads involved, for a total of over 26,000 fathers a year that we get involved. In addition to that, through our public awareness campaign, we have about 2,500 calls come to our Fatherhood office and 211 from community members seeking assistance with helping individuals be better dads. So that's a summary of the initiative. If you would like, you can get some comments from Mr. Stevens or Ms. Hope, but we are here to answer any questions that you might have about the initiative in general or the program specifically. Thank you.
Thank you, Mr. Director Grimes. From my colleagues, I'd like to open it up to any questions. Okay.
I'll take one.
Councilman Sweeney, you have the floor.
Thank you very much, Madam Chairwoman. Requesting permission for a little reflection moment here. I know it's out of order, but I want to share something with you. Is that okay?
Yes, you have the floor.
Thank you. About 20 years ago, one of my colleagues had a focus on this because it was pretty much ignored, the fatherhood world. It was, you know, mom's first and very important to take care of it. But under the leadership of Kevin Conwell, he was an advocate. He never stopped talking about it. Went down to Columbus to promote it. And then he should be so proud. I'm going to call him the father of the fatherhood movement here. And to see where it is today, listen to Mr. Grimes, it blows my mind how much focus is on the father, the importance of having fathers and males in the lives of the families, and coming back to the nucleus family. So I'm reflecting on watching my colleague dream become closer to a reality. So thank you, Madam Chairwoman, and my colleagues.
Thank you, Councilman Sweeney,
Councilman Sweeney,
for the reflection. Any other questions from my colleagues? I have a few, but I was going to open the floor up to you guys. All right, and seeing no hands, I believe this question will be directed to Director Grimes, but it might be Paul as well. In what ways does this contract contribute to the overall success of the county's fatherhood initiative?
These programs are intricately intertwined into what we're trying to do. Each of the programs has objectives that are to benefit the welfare of the community as a whole. For example, the job placement and training programs are helping fathers find jobs and be productive in their children's financial lives, as well as contributing tax dollars to the community in an overall way. The Boot Camp for New Dads program that Sandy Hoke administers is helping fathers who have never been dads learn how to handle babies safely, learn about shaken baby syndrome. It's been a major contributor to reducing infant mortality by making sure that new fathers know about safe sleep so that our babies are not continuing to die disproportionately higher than children in other areas. Mr. Knuckles' program, which is in K through 8 schools, is making sure that fathers not only get involved in the school at the Father's Walk, but stay involved throughout the life cycle of the school year, so that they can assist with parent-teacher conferences, be involved in their children's lives on a regular basis, and then help them get better grades. Our Safe and Sound Supervision program at the Domestic Violence Center, which is now the Journey Center, is allowing fathers to spend time in a supervised environment with their children, in which for some reason or mothers, for some reason or another, they couldn't spend that time because of some incident that happened. We work with domestic court or juvenile court on that. In addition, that program offers a very, very, very important program called the Exchange Program, whereas if for some reason or another parents are not together, and one parent has custody and the other parent has weekend visitation rights, and for some reason when the non-custodial parent picks up the child, there's some drama going on between the two, we can get rid of that by having the custodial parent drop the child off at the Journey Center on Friday, and then they reverse the roles on Sunday. So a lot of domestic violence that you see that occurs during weekend exchanges and stuff, we can help mitigate that through our programs. Our program at the Children's Museum of Cleveland offers an opportunity to fathers who may not be able to take their children to some event or some other venue because they can't afford it. We're offering free admission to fathers and their children. But once again, the goal is not just the museum event, but the goal is go to the Children's Museum, participate in an activity at the museum, and then take that activity home and duplicate that activity at home. So they're all as individual and as individually and collectively are important to improving the welfare of the citizens. And most importantly, it's about the children and what kind of positive impact can we have on our next generation of children. And like I said, reducing some of the things that happen through father absence. I hope that kind of gives you some answers to how it contributes to the community as a whole. And I welcome any comments from the other individuals that are on the phone representing fatherhood programs as well.
Hold on one second. Yeah. All right. I apologize for that, but that was due to our technical difficulties earlier in the day or now that we're not being live streamed. We will not be able to, my colleagues, we will not be able to vote on these two items. We will have to reconvene at another time. And at that time that we reconvene, we won't need all of the presenters to come back. So we're gonna roll out the committee today. We're gonna hear all the presentations, answer all the questions that we need to do. But when we determine that we come back to do the voting, to vote it out of committee, we'll just probably need Paul, who explained the contract and the
Yeah, but
college.
she wanted everybody to present. The actions are what would be illegal.
Okay, Joe, you're not muted.
We're fine.
Joe, can you mute?
Hey, Janine. Janine, can you mute?
I think I should just stop it.
Janine, I'll try to call her.
Let's just hold on 1 second. We're having a great day.
Hey, did she say my name?
Yes, we could hear your
Oh, I'm so
conversation.
sorry.
Janine. Can you mute, please?
Sorry, we're having a little combo in the office. Sorry.
Right, and we're hearing it. Thank you. All right, now we're back.
Hey, Ms. Conwell, I just wanted to add one more thing. And the reason that you see the range of the different programs over the years, we've tried to make sure that we have programs that can be beneficial to fathers at every point in their children's lives. That's why we have the Boot Camp for New Dads programs when they're born. We have the Children's Museum of Cleveland, where they can take children that are infants and toddlers. We have Mr. Knuckles programs where we want dads involved when they're in K through 8. We have our Prevention of Premature Fatherhood program for teenagers, aimed at making sure that teenagers involved and their parents are involved in that age. And then obviously we have the programs to help adults, such as our parenting classes and our job program. So this has been kind of a strategic initiative over the years in making sure that we are covering every area of the child's life where we want fathers to be involved. I'm sorry, I just wanted to add that one more note.
All right, and you were so thorough, Director, in your answer that you answered the next two questions of mine. What adaptations have or will be made to each of the programs initiatives in light of COVID-19?
And, I'm very proud of all of our providers. It was tough initially, especially at the beginning of the pandemic, but all of the programs have been able to make the transition from live to remote. So fortunately, the services did not get interrupted at all because, the job training and placement program at Career Development is now available remote. We have our remote classes for the Boot Camp for New Dads at all 9 hospitals. Mr. Knuckles has had remote classes for his fathers. So I'm really, like I said, proud of their ability to quickly adjust to the change in the environment. As we see the environment changing a little bit, we are shifting back to initially a hybrid between live and remote. And then, as situations continue to improve, we'll probably go back to live. But we've been able to adjust very well to the pandemic.
Yes.
All right. What percentage does this funding represent to the organization's overall budget?
90% of our overall budget of $1 million. 84%. 84% of our program if our budget is for programming. We have very little money out of our total budget for administrative costs. Actually, the administrative staff within the Fatherhood Initiative right now is just me and my administrative assistant. So the bulk of our money goes to programming.
One final question from me. Do the provisions of the contract provide Cuyahoga County the right to audit or inspect the entity's books in their entirety, or to obtain the results of all audits if necessary? That may
Yes.
be a pause question.
Absolutely, Councilwoman Conwell. Those provisions are required using our standard language for all of the contracts that our team works on. We reserve the right to do site visits, and we would look not just necessarily at financial records, but also records regarding client services. And the contract has specific requirements for how long vendors must maintain data and what type of data they have to maintain throughout not just the program, but even after the program ends, in case we would have to kind of do a look back on a future site visit.
In addition to that, one of the things that's been added, and Paul can tell in the last couple of years, providers that maintain information on their clients have to have cyber insurance protecting that. So that's just one more level of protection that the county has and the programs have against, you know, programs, files missing or anything like that. So there's added insurance for over the years for sexual abuse. There's added insurance for cyber insurance and things of that nature. So legal's making sure that the county is well covered in all of the contracts.
All right. And I know you stated earlier, Paul, the RFP was done when?
It was done in January of this year. And if you give me a second, I'm happy to pull up the exact date that it closed. So this RFP closed January 27th for this one. There were 37 different agencies that received the RFP, and we're contracting with 11 different vendors.
Okay. Are any of them new?
Al, I think these are the same, correct?
Correct. Yeah, these are the same. We received 13 different proposals. Unfortunately, the two new proposals, we were, you know, one of the things about the contract process this particular time, we asked for programs who had already had experience in fatherhood work because of the quick ramp up time. We did get a couple of additional proposals, but they didn't score as highly as the existing ones.
Okay, and please elaborate on that scoring process, Paul. Does that include Director Grimes? Is he involved in that scoring?
Absolutely. Al was one of the instrumental folks in that scoring process, and similar to what we do for the other RFPs that we've presented to the committee, we go through a scoring process that involves looking at each element of, you know, required response in the RFP. We evaluate each proposal using the same score sheet, and then we rank those proposals by score to determine which ones get funded. As Director Grimes mentioned, the two new vendors didn't score quite as highly. And I believe a big part of that would be that they had a relative lack of experience in this programming area compared to the vendors that did get, you know, recommended for awards for funding.
Okay, and one final question from me. Next time RFP will be worked on?
But these contracts for fatherhood, these contracts are good for 2 years.
Yep.
And then we have an opportunity, there's an opportunity to add a third year at that point in time to the existing contracts based upon the RFP. But these specific contracts are good for 2-year period.
Okay.
So to clarify on that, then we would have the option to issue an RFP at the end of next year for services starting in 2023, or we could exercise the option year for a 1-year extension for 2023, in which case the new RFP would start in 2024, those contracts. And they would come back to the committee either way, whether we do an amendment or whether we do an RFP.
Absolutely.
And in your past extension of contract, these technically 3-year contracts, when would you come back before us for that, like around in April or when?
Al, looking at the,
Yeah, looking at the current RFP period.
yeah,
Would you kind of like say if this current contract ends March of 2023, it takes about anywhere between 4 and 5 months to go through an amendment process. So
yeah,
at the end of so you'd back up a little bit, you'd say probably in November of 2022 would be when you would, if there was going to be an amendment, you would start that process. Because like I said, in order to get contracts or amended through the system, you kind of have about 4 months of planning time.
and to answer your question, Councilwoman Conwell, about when it would come before the committee, our goal would be to have it appear in advance of the start date, not after the start date.
Absolutely.
So my goal wouldn't be an April presentation. It would be more like a February or March presentation at the latest. So council would have ample time to give full consideration prior to the start date of either the new set of contracts, if it's a new RFP, or the start date of the amendment, if we exercise that final option year.
Okay. Director Grimes, what is your oversight of the individual programs?
Actually, each of the programs present, well, first of all, in each of the contracts, there are goals that they have to meet. Some of the programs are cost reimbursement, but the majority of the programs are a combination of cost reimbursement and reimbursement for goals that have set. So every month I get monthly reports. Each of the contracts has goals. Like I said, some of them are cost reimbursement and some are performance reimbursement. If you don't perform the goals, you don't have an opportunity to realize the total amount of the contract. So we monitor them on a monthly basis, as well as the providers know that the scope of work that they put into their request for proposal is stated in the contract. And if you say to us, within your proposal, we think we're going to serve to 100 folks, then that is what it's going to be in your contract. And we expect you to serve that 100 people in order to realize 100% of the contracts. So it's a combination of the performance goals that the contracts have, as well as our monthly monitoring of the contracts.
And who, for each of those programs, are the agencies responsible for finding those fathers to participate?
Yes, actually, each of the agencies know that part of their responsibility is to recruit fathers for the program. Now, obviously, we will help through our for our promotions and our putting information out to the community. But for example, within Sandy's program, where there's 9 different hospitals that are doing boot camp for new dads, we expect those hospitals to be recruiting within their geographic area or within their particular hospital for clients, for new dads that are coming in as, the new fathers of people who are going to that hospital for services. So for example, if we've got a boot camp for new dads at Metro Health, right? We're expecting the people within Metro Health who are getting ready to have babies to let the fathers of those potential babies know that we have boot camp for new dads within our entity. So no, we're not responsible for recruiting for all of the individuals, and Maurice can tell you the same way, and Fred can tell you, no, they know that they have to be out in their respective communities recruiting dads and families for their programs. So it's a shared event, but at the end of the day, it's up to the individual program to meet the goals.
Okay, and that's good to know, because I know we advertise as the county. I hear your voice often. So take us through just real quickly, if you get a call at the Fatherhood Program and you have a dad, how do they help that dad? Do they kind of steer them
what?
in which program would be best for them?
Absolutely. And you know, it's interesting because when I'm talking about those 2,500 calls, sometimes the calls don't always come from the dads. The calls may come from a mother of a father who's saying, listen, hey, you know, my child is not really doing what I want him to do for my grandchild. You know, can you help him get a job? Because I want him out of my basement. or you know, I want him to be a better dad to his son. And then typically I will say, okay, I appreciate that, but have your son call me. So I want him to show the initiative. And so the calls that come into the office and come into they come for a variety of different reasons. It could be somebody who is a new father who has never held a child. It could be from a father who's seeking custody of their children and don't know the rules in the state of Ohio. For example, if a child is born to unmarried parents, custody goes to the mother. So the father has to go through juvenile court to establish their legal custody and visitation right. And so we give those folks, you know, directions on how to do that. Some folks have issues with the child support agency. So, you know, we direct those folks to the right people within child support. And so what you find is we become like the spoke in the middle of the wheel for a lot of different things that go on in the community. And when they come us, it could be, we will refer them to, if they're looking for a parenting program, we might be general parenting program, they may go to Mr. Knuckles program. If they're looking for a job, they may go to Mr. Stevens program. So depending upon the nature of the situation, then yes, then they will get referred to either 11 of our funded programs or some other department within the county to assist them. So there's, you know, there's a myriad of things that go on. You know, unfortunately, a lot of times we'll get a call from a non-custodial parent that says the custodial parent just passed away. And so now I'm responsible 100% of the time for the child. But right at the current time, because they were with the custodial parent, now I need to set up daycare because I'm working. Now I need to know a little bit more about handling an infant because, you know, the custodial parent handled that responsibility. So, you know, different circumstances come up in which we try to forward the clients to the best agency or program that can handle their problems.
All right, those calls that you mentioned that all the providers get, do we keep that data collectively as in
Yeah,
our?
we have. Yes, we have. Yeah, we keep information on the calls that come in and the type of calls between our office and 211.
Okay, but also the people that may reach out directly to boot camp.
Yes.
Okay.
Oh, definitely. Yeah, and and Sandy has a record of all of the folks who, you know, who attend the Boot Camp for New Dads program, and then there's, you know, an evaluation after the program that says what they got out of the program. All of the programs have some type of component that, you know, gets customer feedback. Yes. So Ms. Holt could tell you how many people went through Boot Camp for New Dads at any given point in time over the years. And fortunately, what you'll find, like in some of the programs, like what Sandy's, our Boot Camp for New Dads, we look at what we're doing here in Cuyahoga County compared to how some other counties and municipalities are doing nationally. And I'm proud to say that, and Sandy could tell about that specifically, per the amount of births in a particular county, Cuyahoga County has probably more fathers attending Boot Camp for New Dads than most counties. That, Sandy, you want to speak to that?
Sure. Nationally, about 2% of fathers anywhere attend Boot Camp for New Dads, and it is a national evidence-based program. And I'm very proud to say that in Cuyahoga County, because of the collaboration between all the hospitals and healthcare sites. We routinely get about 6% of dads, first-time dads, these are first-time dads, and births look at all births. But we get 6% regularly versus 2% nationally and at other counties around the country. And because of that, National Boot Camp considers Cuyahoga County a model program for the country.
Thanks, Cindy.
All right, thank you. One final go at my colleagues. Any further questions?
Yes, I have one. and
Councilman
my
Miller, you
question-
have the floor.
Thank you. And my question is just whether we have any evidence as to whether fathers being emotionally involved with their children is increasing in Cuyahoga County.
Yes, I mean, just based upon the numbers that, from in terms of the baseline, I'm looking at how our numbers continue to rise over the years. And so, and the other thing is what we try to do is, for example, at each of the programs, and even some of the programs, but we will ask fathers at the end of some programming, do you feel, that you can now be more involved or more emotionally attached to your child as a result of the program that you just went through? Or, are you more inclined to be involved in the school? And Mr. Knuckles can talk about fathers that he's worked with over the years in K-8 schools, in their attitude when they first got involved in the program, and how that's changed over the course of time when they've been involved in the program. I think you're
Thanks.
mute.
Okay, you're okay, Mr. Miller?
Yes, I am.
All right, any final questions? All right. Hearing none, we can't move this matter to the full council committee of the whole, but I'd just like to let you know that thank you again for the presentations, all the questions answered, and just to spare you to come back for a quick moment of voting the items to the committee of the whole, you would not have to come back. You will hear word from Mr. Porter of the outcome of that vote. And that is just procedurally to move it to the committee of the whole. So you will hear the committee of the whole, and hopefully we won't have these issues, and you'll be able to live stream that night, and you'll be able to hear it.
Madam Chairman,
Yes,
just a
Councilwoman.
procedural question. Was this in need of being expedited when we do move forward to a vote? Or can this one wait and do the multiple hearings?
Well, it depends on everyone's schedule and how quickly we can turn around, hopefully this week, that we can just have a quick vote and according to everybody's schedules, and then it can be right on the agenda. That's my hope, is that we would do that this
Okay.
week.
Just checking, that's all.
Okay.
But Paul, you probably are thinking what I'm thinking. Go ahead, Paul.
Councilwoman Conwell, I would like to request, give April 1 start date of these agreements. If we could get approval on second reading suspension, we would really appreciate that. And I believe that the programs would as well, if that's something you're willing to consider.
Okay.
Thank you.
And I think Councilwoman Stevens' question went to that a little bit.
Yes.
So
Yes, I was trying to be delicate. I know that's not usual for me, but I thought I'd try that today.
but we appreciate your
Councilwoman.
delicacy.
Thank you.
So that will be considered, and I'm sure somebody will remind me when we reconvene that was your request, and you will have to be present.
Absolutely.
You'll
Thank you.
have to give your little quick overview, and we'll explain for the constituency as well what happened and why we're doing what we're doing. So I
Certainly.
thank you all for your time and attention today. You're more than welcome to continue to join us to hear about community children that are at risk, their families and children. So Madam Clerk, if you could read the next item into the record, please.
Thanks, guys.
Resolution number 2021-0122, making awards on requisition number 3429 to various providers in the total amount not to exceed $4,827,734.61 for community-based services to support at-risk children and families in Cuyahoga County for the period April 1st, 2021 to March 31st, 2022.
Thank you. And who is here to address, Mr. Paul?
Good afternoon, Councilwoman Conwell. I'll introduce the item, and then we're joined by Joe Jackson from the Division of Children and Family Services, and several vendors under this program are there at the Jane Edna Hunter building with Joe. Just to give a little bit of background, this is the funding that DCFS provides to support community-based services throughout Cuyahoga County. As noted in the agenda, these are contracts with 9 local centers serving families with foster children, families of at-risk children, and youth aging out of foster care. There's a focus on safety, permanence, assessing needs, linking to services, conducting supervised visitations, and helping the families and children negotiate regular meetings with DCF case staff for case management for those families with DCFS involvement. These entities also hold monthly meetings for various stakeholders to discuss and highlight specific initiatives and programs that are operated by various organizations in the community, as well as events like back to school backpack drives and infant mortality prevention programming. This was an RFP that occurred at the end of calendar year 2020. DCFS had initially targeted some changes to the program itself as part of the RFP. However, when the proposals were received, they hewed a little bit more towards the existing program structure. So DCFS worked with the vendors to ensure that the new contracts met their expectations as well as the services that the vendors were prepared to deliver. I will note that this is switching from individualized contracts with these vendors one at a time to a master agreement where each of the vendors is a participant on that master agreement. That allows a little bit more flexibility, like what we have with some of the other master agreements that have come before the committee, where if one vendor has a higher number of clients served and another vendor's number is lower, we might be able to move funds around between these programs without having to formally amend the contract and come back before the Board of Control or County Council. So since this is a master agreement, there's a not to exceed amount listed for each vendor, which is the initial allocation. But the important number is that overall value of the master agreement, because again, based on the needs of the families and children that are being served, those dollars may be moved around. This is funded 70% by the Cuyahoga County Health and Human Services levy and 30% funded by federal Title IV-E funding. I'm happy to answer any questions about the contract and RFP process. The other thing that I'll note is we had 11 proposals and 9 vendors are being recommended for services. The 2 proposals that are not being recommended for services were the lowest scoring out of the proposals that we evaluated. And this was the same evaluation process that we do for our other RFPs. The proposals were scored based on how responsive they were to each of the specific areas of the RFP. And then each proposal received a numeric score as a result of those individual scores on those RFP areas. And again, we're recommending the 9 highest scoring proposals to continue on and deliver services under this RFP.
Thank you, Paul. And I missed a whole lot of that. So when we talk after this, I might ask you to recap a little bit for me.
Sure.
I apologize. The county's calling me. So just to give an update, we will move everything to the committee of the whole on Tuesday. The president has privilege to do the vote then, but it has to be live streamed. So Councilwoman Brown, I couldn't answer you right away. We can't do this like we did before because we can't vote totally in this meeting. So we can't vote for a recess because we're not live streamed. So I was getting ready to text you that, but I'm back. I'm back here. And I am still determined that we're going to finish this presentation because of our guests that traveled out of their offices to come here. And we want this to we can't vote at this time. So I would like to open it up to my colleagues because I missed a whole heck of a lot. Any questions that you may have from Mr. Porter? All right. So Paul, I'm gonna kind of ask the same questions that I did for the fatherhood. I don't know if you could answer or if you want to pass it to Joe Jackson, because I'm not clear of the role that he plays. In what ways does this contract contribute to the overall success of the community-based services to support at-risk families and children?
Joe, I'd like to see if you can give a little bit more of a programmatic answer to that question than I can, and you feel free to offer some specific examples.
Absolutely. So thank you, Paul, and thank you, Council, for your time. I would like to let you know who's in the office with us on today. We do have the Director of the Council of Neighborhood Leaders, Dr. Adrian Hatton, the Director, Rachel Milner of the Westside Community House, Carnice McKenzie, Director of St. Martin de Porres, and Elaine Goldstein, Director of the Harvard Community Center. The work that the collaboratives do with the Department of Children and Family Services is essential to the families that we serve. I'll highlight 3 priority areas, one of them being our team decision-making meetings, which many of you might know are the meetings in which we decide on the safety of the children, whether they remain within the home of their parents or whether they need to be removed for safety issues. The collaborators are invited to attend these meetings where there's the potential for the removal of a child from a parent's home. The benefits of having this non-DCFS employee at the table is critical for our clients. The CLAPs provide a neutral party to provide the client support and advocacy through that process. In some cases, or I should say in many cases, the CLAP support and their intervention actually prevent children from being removed from their home. In regards to visitation, or what we call family time visits, this is the case where children have been removed, and we want to assure that those parents are able to visit with their children as they gradually and effectively work back towards reunification. In those cases, research and experience tell us that it's important for children to be able to visit not only their parents, but also their siblings in a safe environment. The CLAPs provide that for us. They provide that social experience for those families on their sites. The collaboratives provide a less restrictive setting versus the family having to visit here at our agency. The next thing that they do, again, high priority in the sense because they do so much, is emergency assistance. The collaboratives provide not only assistance for families with children in care, but they serve to keep non-custody families from penetrating deeper into the child welfare system. Again, they're providing these families with information and resources within their communities. I must say that the collaboratives are the true hubs of their communities. They know what's going on. They know what resources families need, and they know the needs of their families. Again, we do have these agency directors here with us today. If you have specific questions about the work that they do.
All right. What, Mr. Jackson, what critical success factors have been identified to determine if the value outcome desired has been achieved?
Absolutely. So one of the things that we look at is we look at the level of engagement that they're having with our clientele. We look at the level of permanency that we're seeing with children being reunified with their parents. In particular, I should say, what leads to that reunification, which is a step down from these restrictive settings where families have to visit their children in. Again, they serve as having a less restrictive setting. And because of all the resources that they provide, that allows for these families to go home quicker, or I should say be reunified quicker. So those are some of the areas that allow us to see that, also along with, of course, client satisfaction surveys, so that we know we're hearing from our clients as to whether or not there's an increase in knowledge about their communities. We want to see our families do so well and be so well informed that they don't have to come back into our agency, that when they're dealing with issues within their homes, that they know where to go to get those resources, so it doesn't get to the point where abuse or neglect happens, and they're able to work with their community, work within their communities with these resources that are available to prevent that from happening.
Thank you. Any questions from my colleagues for Mr. Porter or Mr. Jackson before we move to hearing from the providers? All right, seeing no hands. All right. So we'd like to hear from, who do you have? Who's willing to speak first, Mr. Jackson?
I'm going to defer to the Director of the Council of Neighborhood Leaders, Dr. Adrian Hatton.
Okay. Welcome.
Yeah. Good afternoon. Okay, so I just could share a little bit in addition, or then take specific questions. Just wanted to note a couple of things in regards to some of the questions this afternoon. In addition to the families that we serve who are active custody cases with Children and Family Services, our services are also available to families in the community who are able to walk in and ask us or inquire because they're informal kinship care providers or formal kinship providers and need additional support. We also provide basic needs and additional emergency assistance to families in our communities with the hope of sustaining and strengthening them to sort of avert crisis. In addition to the work that we do at developing services and working with the providers in our community, we also connect with other initiatives that are going on that have the opportunity to impact our families as well. We are partners in the Safe Babies Court Team model that's new to Cuyahoga County, and also in the Kinship Navigator program that is statewide now through Ohio Connect. So we really try to take the experience and knowledge that we gain and have gained from working with families to really connect to other initiatives so we can make sure we're getting sort of a unified approach and that those new initiatives can benefit from the knowledge and experience we have with our families. The other piece I wanted to mention is that we do assessments with all of our families, and then we track their progress across a variety of domains, everything from income to childcare needs to family education, just to a lot of those, 9 of those domains tend to impact family stability. And then we track our performance in terms of how we're moving the families along the continuum based on the needs that they present with. And so we're able to use our data system to really track what services are provided. We're able to track where families are being served across our network. And in addition, we're able to understand where they're making progress and also to think about what other needs that might need to be developed in the community. So I just wanted to share that we track our data monthly. We do complete monthly reports, Excel, quantitative and qualitative data that we discuss in our monthly council meetings, where we do spend time with our directors and our managers and all of our staff, trying to keep our thumb on sort of what's happening and to be able to make mid-course corrections if necessary, which is something that COVID prompted for us because of course our partners remained open and continue to remain open on all kinds of schedules, rotations with staff, using virtual means to stay connected with families and to connect families and visits to make sure those happen, and also to stay connected with providers to make sure that the services are available. So we partnered to offer PPE to communities, to offer vaccines, to offer testing, to offer basic needs. And so that's just sort of, I think, an example of the fact that because we have been here and we've been supporting families in our communities for so long, we were in a position to really sort of deploy resources to those communities even during the crisis. So I'll stop there in case there's other questions.
And thank you, Dr. Head. What can you share with us, the committee, what role do you perform for the collabs?
Yes, so I provide, basically I focus with them on a couple of things. One, really, I have the bird's eye view, so I look at data and information across all of the partners, and I perform gap analysis. I kind of say, hey, we're dropping here, we're struggling there. I serve the role of being a representative for the council, for all of the members in terms of other initiatives that are going on. All of our directors, of course, are running their day-to-day, running their sites, and I have the position of really making sure that we are connected where we need to be in the community. I also perform a role related to performance management. I work with our data person, and I look at our data and I work with them to make sure that we're aligned with the reports that we need to provide, and that we're also capturing data that we can use to develop our model, because that's one of the things that we've been focusing on. We have an evaluation that's starting, because we're really trying to make sure that when we say here are the key components of our model, we have the data behind it to support it, and that we're telling our story in such a way that reflects all of the work that goes in. So my role is really to also to develop our staff in terms of if we have protocols and procedures that we need in place. I work with the various committees to make sure we get those things done. And I'm a liaison to DCAP, to Department of Contract and Procurement, as well as Joe Jackson and others here at DCFS, just to make sure that we're able to be on top of things, to problem solve, and that we're sharing information back and forth. And then finally, one of the things that I do is really help to where we need to focus on orientation, our relationship with other partners, communication, and to some respect, branding. So I really have when we say managing director role, I'm really kind of focused on sustainability and areas related to that.
I want to follow up with that. So you shared with the committee how you the role that you perform with everyone, with all the collabs and all the partners, as well as DCFS. What is your how many hours does it take for you to do that? What is your?
Well, typically I've performed that role in the past in a full-time capacity. So, you know, typically 30 to 40 hours a week when you think about communicating with 9 or 11 partners, with all levels of staff, making sure that communication at the meetings, the process goes on, reviewing data, troubleshooting. So yeah, typically in the past, my role was a full-time position.
And so you mentioned, and I apologize, you mentioned that you used to complete this in a full-time capacity. What are you providing now? How many hours?
Well, if you're speaking to in terms of what's supported through this contract,
yes,
or are you just speaking in general?
Just in general, and moving forward in this contract, will you be at a full-time capacity or something else?
No, I'm actually not officially included in this contract year, but I'm in conversation with other ways that I could support the council and seeking other additional funding to do so.
So thank you for that. So that generates some more questions, but I'd like to call on one of the providers to share Dr. Hatton's role and how it's been effective for your agency, or what she gives or what she brings to your agency. And let me hear from Harvard Community Center.
You want to hear from a veteran, huh?
Yeah.
You know,
I had the pleasure to see you yesterday, so it was kind of great. So we're gonna.
Thank you. Dr. Hatton's position was built into the council about 15 years ago. The council has been together for 25 years. We came together because we wanted to make sure that we spoke with one voice. And so it was easier said than done, because we had so many different directors and different staff people. And so we wanted to make sure that we came together unified because of the wonderful partnership that we had with Children and Family Services. And so as a result of that, we decided, okay, we need a managing director. someone who could really act on our behalf, we're not able to, because one of the things, not only are you the director of the collaboratives, there may be some other programs that come under your preview. So we wanted to have someone that could interface with the department, interface with other partners, and look at other funding for the collaborative so that we can begin to shape this model as Dr. Haddon talked about. And I don't know if you remember, Madam Chairwoman, when the Annie E. Casey Foundation was selected Cleveland to become one of their partners. One of the things they used to do is they would send people from all across the country as they opened up new collaboratives to look at the model here in Cleveland. Because we had shown that we had pulled together something very unique and something powerful. So when other collabs became open in other areas, they sent them here. And we said, okay, this is outstanding. So what should we do? We know that we couldn't do it a lot with all the other responsibilities. So we said, we need a managing director. Plus, we needed someone who could interface with our partners at the county to ensure that we were doing what we were asked to do. So for me, and I'm sure for my colleagues, this is a very important position. And as we're looking at, people are asking us now, how are you doing it? It's one thing to collaborate, but how do you collaborate? And you get collaboration to function in a way. Just as you said, like yesterday, you said it took a lot of partners to open up a diversion center to be the first in Ohio to do that. And it wouldn't have happened without the collaboration of everyone coming together. So this is why it's so important that the position that we have, our managing director, is to keep us focused, to keep us meeting because Joe Jackson is on us. He wants to make sure we have our numbers together, and we make sure that we call him and tell him if there's a problem. And then he calls Dr. Haddon, want to know, well, what's going on in Harvard? They can't get their stuff together. It's that kind of partnership. We are looking over each other's shoulders and making sure that these families are being served. And I just want to say one thing while I have the floor. Change has come through our shared utilization of solid, old-fashioned, family-to-family values and voice and choice that is a driving force behind the promotions of the safety, permanency, and well-being of children. 85,000 families have been served through this program. And when we start looking at the data, truly looking at it, we're looking at now that we have at least 6,000 children that are in care, when we had gone from like 25,000 children who were in care. And I may be off the numbers and we can get that straight later on. But I'm just telling you what I'm thinking about and what I heard about, because this is such a grand partnership. And as Joe said, and I know I'm doing all the talking, y'all jump in, okay? They like for me to do the talking. But the other thing, Madam Chairwoman, is that, as Joe Jackson said, we know our neighborhoods. We know the people come to us, even if someone gets in trouble, and they know their family is in trouble, they come to us. That's old time social work. That your neighbors will come and let you know, so-and-so needs a bed at their home. We get on that right away. So I'm gonna end here. Thank you for letting me have the floor. But I think that we need someone like Dr. Haddon. It's imperative that we have her continue with her. And we cried when we could no longer put her in the contract. We actually cried about that because we worked hard to make that happen. So thank you.
Thank you, Director Goldstein. Any questions from my colleagues before I ask my next one of Director Goldstein or Dr. Haddon? Does anyone have any questions? All right. And I don't know who would answer this next question, Paul, but are the agencies equipped to perform without Dr. Haddon's role?
At this point, the contract is based on the services that were indicated in the proposals from the vendors. And then, you know, DCFS took a look at the budget, and as I indicated in my opening presentation, determined a way to move forward with this master agreement, even though there had been thoughts about, you know, changing more what the model looked like. The proposals were still closer to kind of what the model had been under the previous contracts that ended 3/31. I would ask for a little bit of feedback from Joe, I guess, about whether the programs can continue to operate. My perspective is, yes, that they can continue to operate, and that I think there's still a place for Dr. Hatton. The contract that we're entering in is with just the vendors that are actually operating these sites, not necessarily a contract with Dr. Hatton. And we have a variety of contracts where, you know, subcontractors are engaged by the vendors. I don't know if that would be the kind of relationship that would be, you know, best served for Dr. Hatton and for the vendors under this contract. But again, the way the contract is, it's based on contracts with the vendors who propose delivering, not necessarily a direct contract with Dr. Hatton. Does that make sense?
It makes sense that you're giving them the option, all the collabs, the option to subcontract with her. But I think this committee needs to understand how did it change? And if we're talking about funding, I believe the way it was before, each collab out of their budget, they put together some sort of package where it paid for Dr. Hatton's salary as well as the data system. Right? And that was a collective front doing that.
I believe that was the case. This is not one that I was as familiar with during the previous iteration. So I don't know if that's something you're able to give a little bit more insight into, Joe, how it was before, and, you know, what the internal discussions around funding it are, I suppose.
Yes, so I failed to let you also know that my boss, Deputy Director Jackie McCray, is also with us in this office. You are correct in that that's the way it was set up for council. In regards to the amount of funding actually remained the same from the last contract year into this year. So the funding didn't change. The deliverables, however, did. And so we decided, a decision was made, I should say, to make sure that the funding got directly to our clientele. We saw a need for greater coordination around visitation. That has definitely been a concern over the last several years. So to your question, as has been stated, yes, we believe they definitely can continue without that role. Is there a benefit to her role? Absolutely. But again, the funding amount didn't change, I should say.
So you're telling us, Mr. Jackson, that 25, well, let's just go 15 years since they had the director. So a 15-year program with the role of the director, because I've met several of the directors in my tenure of 10 years. So you're basically saying that somebody made a decision somewhere, the money has stayed the same, and please correct me if I'm wrong, the money has stayed the same to all the agencies moving forward in this new contract from the previous contract, but somebody made a decision to change the flow, so to speak, of how the agencies, the collabs, want to do business with the county. And
I did not state it that way. What I stated was that we wanted to assure that the deliverables to our clientele, that did change. And we knew the funding had not changed, but the deliverables in regards to what's expected to get to the bottom line, which is our clients, that did change. And while the funding didn't change, that changed.
Okay, so,
For Deputy Director Jackie McCray is here, she can speak further.
okay, could you, Director, please, Deputy Director, please speak to the deliverables?
Good afternoon.
Good afternoon.
Good afternoon. Some of the deliverables have actually intensified. So some of the things specifically around some of the family visitation, there are additional things that we are asking our collab partners to provide to our families as part of that. The volume has increased, and we have heard back from a number of our collaborative partners that the work originally envisioned around some of the visitation support, they're doing more than what was originally envisioned. So some of the consideration was we needed the funding to support the actual day-to-day hands-on work that was being done. So the funding, we made the decision that the funding would actually follow the families and the needs of the families. Dr. Hatton definitely serves an important role. However, when kind of faced with funding direct services and supports the family and funding kind of that collaborative role, we made the decision that the money would follow the families. We have a number of other contracts where we have a lot of directors who have a lot of things on their plates, but there's no coordinating body that we support for those particular services that are delivered to the county, which are just as vital.
Okay, and who could speak to how much the cost is, since Jackie stated that everything has intensified in terms of deliverables. How much money are we talking for Dr. Hatton's salary? Because I'm assuming that the data system is still in play. So can somebody share what the data system cost and what Dr. Hatton cost?
I'll have to defer to our partners that are here.
Hello, this is Rachel Milner from Westside Community Housing. I can't recall the exact amount for the data system, but for Dr. Hatton's contract salary, it was $80,000 annually.
Was that 8 or was that 80?
80.
So the structure to that was that each partner paid a monthly amount that was a portion of my salary and Ron Smith's salary. So it was paid out monthly and a part of the reimbursement back to the county. So that it was sort of like what would you call it, a membership fee almost, but it was really my salary, Ron's salary, costs to maintain the database. So basically that was the only infrastructure cost related, and it was divided and then reimbursed back to the partners based on that specific amount each month.
So Deputy Director McCray, $80,000 is basically in play. So that $80,000 was divided to 12 collabs. Is that correct?
Yes.
Yes.
Oh, sorry.
And we
Okay.
pay monthly fee, Madam Chairwoman, Mrs. Elaine Golson. We pay that monthly fee to Eastern Neighborhood House, who's our fiscal agent, and they cover the cost of paying Dr. Hatton and also our database consultant to handle that.
Okay.
And they came out for each collab about $2,100 a month.
100 a month. Okay, let me ask.
About $2,100 a month.
$2,100 a month.
That we would pay, and that included the cost.
Okay, let me ask an overall question. And the overall question would be, we have 12 collabs. Are all 12 collabs in agreement with this decision?
I'm going to defer to our chairperson, and we have both our chairperson and assistant chairperson of our council here.
Okay, let me hear from Paul. He raised his hand. Go ahead, Paul.
One thing I just wanted to clarify regarding the total number of collabs, there's 9 collabs being recommended for funding under this, not 12. I just wanted to make sure. I think it might have been a prior number, but for the record, this year it's gonna be 9 starting April 1.
Well, the benefit we have, we're not being recorded. So we'll make
Yes.
sure that correction
Absolutely.
is for the next time.
Can I clarify that? And Paul is talking, you know, we have 2 of our agencies, 2 of our collab members. I know with Merce Taylor has what? How many?
Three sites.
So there are a total of 13 sites, but
Yes.
9
Sure.
agencies.
Yes, okay.
Several of the agencies have multiple sites.
Okay. Thank you, Joe.
You're welcome.
Okay.
Chairwoman, I think we are actually being recorded, though. I just don't think we're streaming, just for the record.
Okay, thank you for
Yep.
that reminder. One question that I have, I don't see any hands from my colleagues. Is there anything, and I guess this would be directed to you, Paul, is there any, you or Deputy Director McCray, is anything we can do internally to provide the CLABS assistance? Was that thought of? I mean, I heard Deputy Director say that we have many programs and they don't have this type of setup. And I get that, but this is a unique community-based program that is 25 years in existence, 15 with this kind of setup. And so you've got to come better to this committee about the changes. And I get that, you know, deliverables were intensified, but nobody reached out to County Council, to President Jones, to say that anybody was struggling and that we needed, well, let's look at some more money or whatever. I mean, decisions were, so I'm just letting you know where I'm at.
I think as Deputy Director McCray mentioned, and you know, Joe mentioned this as well, it was more of a shift in focus towards dollars going to the direct services rather than the administrative side. I don't think anybody at DCFS or in HHS as a whole said that the role isn't valuable. Our perspective is, where do we want to invest the county's dollars? And the decision was made to target it at those direct services specifically. Thinking of another example that contains many of the same vendors, the Division of Senior and Adult Services operates a community social services program where we fund direct services to seniors on a cost reimbursement basis, which even looks different than the invoicing for community-based services, where we're paying for the number of hours of adult development delivered to seniors, or the number of meals eaten by seniors, either from that center or at that center. We recognize that there are administrative costs associated with operating a senior center. Some of that work includes work of a collaborative nature where one senior center is working with another senior center. So the model is not exactly the same as this community-based services model, but that's just another example I would point to where there's a conscious decision that was made to make payments for those direct services, and then the agency can determine how best to cover the administrative costs associated with delivering those services. That may not be the best answer, but I'm trying to search for another example that I could point to where we focus on the direct services more than we focus on the administrative piece of providing the services.
Do you feel, Paul, that there is any danger of with this direct person that has been kind of tracking everything from all the collabs collectively? Do you think there's any danger in the future of the collabs whittling away from your perspective?
From a contractual perspective, I believe that Division of Senior and Adult Services has a commitment to maintaining this model of service. You know, this RFP includes the option to fund these services through calendar year 2024 if we decide to exercise some of the option years that are available on this. So there's a definite commitment to maintaining this model of service. You know, I think we've heard that this is a critical role that, you know, Dr. Hatton plays an important part in this network of vendors and in this program overall. My ask would be, is there a way for these agencies to continue to support that role while at the same time using the county's dollars more on these direct services? It sounds like the agencies are saying that they feel like this is an important role as well.
By any chance, for the data service, these are conversations that I've had. You know, this is not new to me in any way, but for the data service, you guys give me some thoughts around. We're okay with utilizing the data service that they, I don't know if they contract with, subcontract with, or whatever, versus something internally?
So, Councilwoman, today, we actually have two different data services right now. Not all of the collaboratives utilize the same data service. And so that data service feeds a monthly report, and both of those systems have to feed that report. We have expectations around that monthly report. We have definitions for each line item on that report. And so as long as those systems feed that monthly report, no matter which data service they decide to subcontract with, we just want to make sure that all that information is the same. That's the reason why it's been well defined. And we continue to meet with the collabs. We've met with them recently, as many as 2 times last week. And we'll continue to meet with them to assure that the data that's going into each of those services is the same.
Okay, Mr. Jackson, can you send me the collabs and which data systems that they prefer to use?
Absolutely. Again, I'll send you both.
So one is internal. I'm just trying to be clear. So one is a county internal system, and then one is the one that's subcontracted amongst the collabs. Am I correct?
No, ma'am. There are 2 internal services. One is called NCIS. I apologize, I don't know the name of the second one, but they are both subcontracted services external to us.
Okay, external.
If I might interject, this is Deputy McCray, that I believe that the systems utilized to also assist our partners in their day-to-day work and serve as their case management systems. So in addition to what they may use the system to track some things for this contract, they also use it as part of their day-to-day operations.
Okay, the collabs do.
The collabs do, is that correct?
Correct. So may I make a comment? May I make a comment? I'm sorry.
And who is that?
Dr. Hatton.
State your name, thank you.
Hi, Dr. Hatton, I'm making a comment. I just wanted to add that for the collabs that can continue to collaborate as a part of the council, all of them are using one system. And that's a system that they've been using now for almost the entire 20 years. So I just wanted to say that there are now 9 collabs, 8 continue to work together collaboratively through the council and to utilize our NCIS data system that we've been using for the last probably 15 to 20 years.
Okay.
So while there are 2 external vendors, there's sort of one with 8 and one with 1.
I get it. So I don't know who would send me the information, but I would I would need to know, and I guess that might be Deputy McCray, or Joe Jackson. I just need to know which collabs are under which data system, and how much it cost for that. I guess collectively as a collab is paying, taking away from direct service for the data and for the Dr. Hatton's salary. You know, granted, she's not in this one going forward, but what it cost in the last round. Okay, broken up to what each of them, if I'm explaining that right, each of their pay to, and I think that will help me, give me and the committee a clearer picture.
We can put together an email for you, Councilwoman Conwell, and get that over to you prior to the meeting where this will be voted on.
Okay, will it take that long? Because
no.
Okay.
We should be able to get it within the next day.
Yeah, what it looks like the determination was, and I'm going to remind everybody again, is that we're not going to have this little off meeting. Everybody's schedules are great. You'll just have to be at Tuesday's council meeting, and we'll do the vote there.
Yep.
Okay, for both of the contracts, either up or down, whatever the case may be.
Sure.
Okay. Any other questions from my colleagues in regards to this, in hearing the testimonies of Dr. Haddon or some of the representatives, Ms. Director Goldstein?
Madam Chair.
Councilman Miller, you have the floor.
Thank you. I just have a comment, and I'm gonna try to put this delicately, but as I understand it, what you did is that you raised the expectations of the services, both amount and types, to be provided. And so of course the agency said, well, we're going to need more money. And so then we responded by saying, well, we're going to keep the total amount of money the same. We're going to put all the money into services and delete Dr. Haddon's contract plus the data services. It's and that if people value those services, then the agencies are going to have to find resources to pay for it. It kind of sounds like the old speed up, you know, just it's a squeezing of the agencies, and I think what's needed is more that we should say, well, is the data work in Dr. Haddon's services important enough and contributing enough to the overall success of the program that they're worth it? And if so, we should find the money for it. So that's just what I have to say. Madam Chair, I think you're muted.
It's that hidden of that button. I hate to even touch it. I asked if there was, thank you, Councilman Miller. Was there any final questions or concerns from my colleagues in hearing the testimonies that were shared today? All right. Hearing none. Okay, well, the good thing of this for us, since we've been presented with new information that I guess I wasn't expecting, we don't have to make a vote. We have until Tuesday to make up our minds internally how we would like to proceed. So anything else that Mr. Jackson or Paul or Deputy Chief McCray or any of our guests would like to say before we end this committee? All right, hearing none, we are good. And Councilman Sweeney, are you still present? Councilman Sweeney? All right, Councilman Sweeney is muted at the moment. I'd just like to say that thank you all for coming out, especially our guests that traveled to the county. We appreciate that, your time that you've taken out of your busy schedules today, and I apologize for the technical difficulties that we've all experienced, and I apologize again that we're not able to vote, but due to our rules and regulations, you know, this stuff must be live streamed and must be open and transparent. I didn't want to have to ask you to come back and do all this again. So that will save you your time and money for having to do that. But please stay tuned, live stream on Tuesday afternoon. I don't know where you'll fall in the agenda, but stay tuned. And I do apologize. I know this is not the method in which we operate, but we all live in with technology today. So we're learning to bounce around. So thank you for your time and attention. And I just want to continue on. Is there any miscellaneous business that anyone would like to share in terms of the committee? And my colleague, Martin Sweeney, has not rejoined us, but he wanted me to mention Cinco de Mayo Day. So I was going to give him the thunder and let him do that since he had text me about it. Don't forget, he's our holiday guru. He keeps us on task with the holidays. So I apologize that I did not mention Cinco de Mayo earlier. And nothing else holding our time or attention. This meeting is adjourned.
Thank you.
Have a great day, everybody. Thank you.